Welcome, 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 everyone. Welcome, welcome, welcome to the Carnosine Code, unlocking the Carnosine Code and our Carnosine Lab. Presenting tonight, we have an incredible guest, Dr. Kevin Keys, and I'm going to get to that in a minute. But before we do his amazing introduction, I just want to welcome everyone from across the country and around the world. We are streaming live on YouTube, Facebook, Instagram, and other platforms. So all of you tuning in tonight, we'd love to hear where you're tuning in from. Drop your country, your city, or your state in the chat below. We'd love to hear who's tuning in, and feel free, as you're tuning in tonight, drop in the chat some questions, some comments, your story on carnosine, and we are going to unlock to a deeper level the Carnosine Code tonight. So without further ado, tonight we have the incredible Dr. Kevin Keys. Dr. Kevin Keys has been 27 years in clinical practice as a chiropractor. He runs one of the largest practices in Woodland, Texas. He's an amazing family man, a husband, and he has been using and working with Lactigo within his practice for over 7 months now. So Dr. Kevin Keys, we're so excited to have you here live with us on the Carnosine Conversation tonight. So why don't you tell us a little bit about your experience, what you're seeing, what excites you the most right now with carnosine?
Well, thanks for having me on, Jess. Yeah, I really am excited about carnosine. It's been a great tool to have in clinical practice. I was introduced to it, like you said, 7 months ago. Started off a little slower, but certainly as the results started to pour in clinically, it was learning all of the science and research and everything behind it is great. And we'll talk a little bit about that tonight. I mean, carnosine's been around for a very long time. It's very well studied, has over 3,000 published papers regarding its use and its benefits for the body. But as anything, I like to see how that unfolds within clinical practice and how it actually produces results. And I'm extremely pleased with it. And we've been using it and seeing just phenomenal changes in patients in very different cases. And we'll talk about that later as well.
Well, let's dive in. Everyone wants to know, what actually is carnosine? So can you unwrap that a little bit for us tonight as we dive in?
Sure, real simple. Everyone's familiar with peptides. Basically, peptides are chains of amino acids. It is a dipeptide. So you have beta-alanine and histidine. The problem is that getting carnosine into the body, if you take it orally, it has to pass through the digestive tract. The digestive tract has digestive enzymes that will actually cleave that dipeptide bond, rendering it not effective and absorbable into the tissue. So we need to get it into the body. And this carnosine gel with Lactigo specifically, their transdermal, the technology that they have, this delivery system that they have is extremely effective.
So a lot of people want to know, thank you for that explanation. It's so good to know, how does it work? What is it? And as most of you know who were on last week, and if you weren't, go watch the replay with Dr. Willie talking about how our carnosine levels start to decline after the age of 10. So it's so important, if you're over the age of 10, drop a heart in the chat, because it's so important for us as we're aging and cracking the aging code, right, to elevate those levels. So what are some of the best ways, and how do we elevate the levels of carnosine in our body?
Exactly. Like you said, that those levels do drop as we age, and carnosine it's a naturally occurring dipeptide within skeletal muscle, within brain neurological tissue, as well as heart or cardiac tissue. And so since it does decline, as far as getting it into the body, nutritionally, if you were to take it through a supplement, again, it's just been very difficult to achieve. So with the technology that's been developed in doing this through the skin and penetrating into the body, that delivery system basically starts to increase that over usage of time. So it is condition specific. So for example, if you're dealing with an acute situation that you're trying to affect, we typically want that to be closest to the region that you're trying to affect. And we typically apply that About this, little bit larger than pea size.
Mhm.
That area 3 times a day, even up to 4 times a day. This does not interact with any medications. It doesn't interact with any other supplements that you may be taking. It absorbs within 5 to 10 minutes of application. It starts to take effect within the body. So that's really quick. It has some anti-inflammatory effects as well as anti-aging effects, which everybody likes these days. It is so it has this antioxidant, very powerful antioxidant effect, and it has a neuro calming effect. So it basically calms the nervous system. So it has a wide range of uses, not only condition specific, but if we take a look at this generally for supporting general wellness and for you to be your best, this is really a knockout product for that new emerging longevity field that everybody's interested in.
So amazing. Thank you for sharing just, how it works, why it works, how to elevate it in our bodies. And as you see, people typing in the chat, how it's helping them. What I love is that you talk about zero contraindications,
Yeah.
zero side effects. Can you use it too much? And when you're talking about what it does for your patients, talk to us a little about what you're seeing in practice.
Right. So we have a very busy, very large practice here. Obviously, being in the chiropractic field, we do see a lot of musculoskeletal complaints, a lot of neurological based complaints. So specifically for that and our athletes and for performance, it's extremely well studied within the sports world in basically for performance. So performance or workout, and then also following up afterwards to help with muscle recovery. Basically, it has an ability to take the acidity level within the muscle down after when your lactic acid levels increase. It actually helps to decrease that. So it's extremely effective in that realm. But when you have a painful condition, for example, all the pinched nerve sciatica, carpal tunnel neuropathies that we see, it is able to benefit these patients in ways that we haven't seen. For example, TMJ related issues, those can be quite life impacting for people. And they can be difficult to treat, but again, applying that just into the TMJ, doing that 3-4 times a day, people have been seeing great results with managing their pain, not only just managing it, but again, getting those inflammation levels down so that we actually see resolution of their problems. And then once they move from that stage, then we get into the wellness phase of using carnosine, where that becomes a twice a day, for overall benefits. Your one question about can you use too much of it? The answer is simply no. The body actually, your carnosine levels are really never going to get to that point where it's non-toxic. Your body actually puts it to use. It's the body, as we know, is very innately intelligent, and it knows what to do with these building blocks within the body. So it's going to be just more protective, and it will have it on reserve in that area that needs, wherever it needs to go within the body. But like I said, if you're dealing with a specific condition, you really want to try to apply that as close proximity to the area that you're really trying to affect.
Fantastic. So, if you have, hurting knees, throbbing knees, aching knees, apply it to the knees.
Correct.
But if you have a hurting foot, sounds like it's a healing agent, and it's going to make its way through your body and try to fix those things. Is that correct?
It is. Yes. Yeah.
So basically, every time I hear this, you guys, I want to jump in a bathtub of Lactigo and just continually rub it all over my body, right? I think that's coming next. I'm going to keep saying that until it happens. The next thing we want to dive into is, what dosage do you recommend when you see patients in practice, when you're talking to an active or symptomatic patient? Let's talk about, those conditions, and once stable, what's recommended for general wellness. So let's talk about those two groups.
Absolutely. So it's very practical. And so there's not a lot of guesswork about this. So the larger the area you're trying to affect, then you're probably going to need a little bit larger amount, okay, for that delivery, that dose. So if you're trying to cover a larger body area, it may go from a pea size to, a, dime size, as far as how much you're actually putting on your hand, and then you're massaging it into that area. So how many frequency is like, well, that's how much. So how often, if it's an acute active related problem, like I said, 3 to 4 times per day. And then that's until things are stable, till you're really feeling like, hey, I'm well. And then a wellness dose is like, okay, well, I don't say you're having some issues with like foot pain, like you were saying, right? Well, then it's resolved. I'm well. What do I want to do for general wellness? Well, for general wellness, we want to absorb this into our body. You could put it on your arms. You could put it on the back of your neck. Again, for wellness wise, it's a pea size. Rub that into an area that you want to quickly absorb. Again, arms, the backs of the arms, the inside of the thighs, that absorbs very quickly. And you can do that twice a day for just general wellness purposes.
Fantastic. Like in our household, we call it the topical multivitamin, so it's used every day. It's like a topical multivitamin, right? It's something that you want to take every day, whether you're feeling pain or not, because it can be very preventative as well. Doc, I absolutely love, when you're talking about TMJ, we've seen some great results with that from little kids, at all ages and all stages of adulthood too. So if we want to, talk about that, what would you say for those individuals, where to apply it, certain conditions? Let's dive into that topic a little bit.
So as far as specific conditions, I think that anything that has an inflammatory component, if we take a look at all the pain related things, right? So like if you take a look at arthritis, okay, that's an itis. All the itises involve inflammation. So carnosine, one of the great things about carnosine is it actually reduces inflammation. So it helps, like I was mentioning about when we have muscle tension, when we're under pain and we're inflamed, what happens is muscles become tense. When they become tense for a long time, they're under tension for a long time, then you will accumulate lactic acid within the muscle. And then the muscles, you just keep driving this whole cycle. One of the other effects that it has is this relaxing effect on it. It basically helps your GABA, which is a chemical within the body that helps relax. So it helps you fall asleep better. So for general wellness, putting that on before bed will help you get a better night's sleep. And it also inhibits your the excitatory, like for example, glutamate is one of the chemicals within the body that tends to be excitable, and it will actually help downregulate some of the glutamate and upregulate your GABA. So for condition specific, there's just a host. I mean, I could talk about tension type headaches. I could talk about migraine activity, TMJ. Carpal tunnel, all the tendonitis, every tendonitis is a inflammation of the tendon. So it's pain related, driven related. So if you have a rotator cuff tendonitis, a bursitis, that's inflammation of the bursa, like in your shoulder or your hip. Again, we talked about knees, feet. So basically, if you're experiencing some kind of symptom somewhere within your body, if it's pain related, this is just a great tool, and it works very different than all the other things on the market. So one of the things we see, like everybody knows about all the pain creams that have like menthol in them and everything else. Well, that just has a very short-term effect to basically trick your brain that you're in pain. Okay. Mm-hmm. Whereas this actually has a physiologic effect and actually works on the inflammation within the body. So that's the key difference. What other kind of gels and lotions and creams that are out there just simply doesn't do.
exciting and
Yeah.
mind-blowing too. It's just so incredible, such an amazing product. And once again, I want to preface too, we don't claim to cure, prevent, or treat any disease. This is not medical advice. This is, what his practice is supporting. So thank you, Dr. Kevin Keys, for diving into that. Now let's switch gears a little bit. I'd love to hear, for you've been in practice for 27 years, right?
Mhm.
You just started using this 7 months ago.
Yeah.
What's been the most exciting change that you've seen, or shifts that you're excited about for the future, and maybe what you're experiencing currently?
I think speed of recovery has to be huge. People come in and they want results, and they want results
Mhm.
quickly. This, I'm a healthy skeptic. So as I approached it, I was like, I'm willing to give anything a try. I first read the science, then I want to hear some of the other practitioners, what they're experiencing in it, and then I'm willing to give it a shot. But if I'm not going to see in a certain patient population that I'm driving some kind of effects and positive effects, then I'm going to shy away from it. So the thing that I saw was across the board. I mean, some people respond better. It's just, people that are compliant with it, and it's so easy to be compliant because it's not another pill to take. You don't have to digest it. If they'll just simply, the people that we've had, that have purchased this in the practice and are using it, the ones that actually use it, like if people come in and I say, how are you doing with that? They'll say, oh, well, I'm not using it. Well, I tell them, just start using it. And it's a great tool. It's very simple. People want to know, what can I do for myself? What can I do to help myself out? And so it's just a very simple thing that people can do at home in between their care, and it helps accelerate their recovery. And then again, from the main thing, and you brought this up about diagnosing diseases and conditions, that's not what we're here to do. What we're here to do is, again, understand that the body has an incredible ability to take care of itself when it's given the right environment. And we know that from the study of epigenetics, that if your actual emotional state can actually have an impact on your physiology, so can nutrition, so can exercise. Well, guess what? Carnosine actually affects your physiology in your body. It helps create a great environment for the body to be healthy. So again, I know that most people's, their perspective is get a diagnosis and, then treat with this specific, whether it be pharmaceutical or specific procedure. But a different perspective to look at if we see the body as self-healing, what can we do to help support that environment for people to get well on their own? And that's how I embrace my practice, is that I'm not performing a specific procedures on people that I'm the one that's healing it. It's actually, in fact, their bodies that are healing themselves. And it's a very powerful thing. I can say it with conviction and certainty because I've been doing it for 27 years. And so it is exciting for me because after 7 months of implementing in the practice, we're just seeing an acceleration even in the healing process. So it's wonderful.
So incredible. It's wonderful to hear from you too, as you share this with patients. Not only do you love what you do, and obviously you're so great at what you do, but adding this amazing secret weapon into your practice is allowing you to support people in that prevention journey, in their healing journey, and really amplify what you do to a greater level. So we're so excited to have you part of this team, part of this journey, and part of the Carnosine Lab. We do this each and every Tuesday, you guys, and I love seeing all the comments flying into chats from YouTube, Facebook, Instagram. Those of you joining us now or are just tuning in, drop a note in the chat. How has Carnosine helped you? What are you looking forward to? And where are you tuning in from? Each and every Tuesday, we do this live with a medical practitioner or an educator to bring you tips, tools, and tricks from about carnosine. So next week, we have an amazing practitioner. She is a wellness and aesthetics guru. She covers skincare. So all you ladies who are wanting to not just change internally and support pain, but wellness. And like Dr. Kevin Key said, wellness from the inside out. And when you're feeling well from the inside, it reflects largely on your skin. And I see you nodding over there, Dr. Kevin. So I know you know that's true.
Yeah.
Before we let you go, Dr. Kevin Keys, leave us with a tip, a mantra, your message for our viewers, something that you want to leave us with, whether it's about carnosine or life in general. We'd love to hear what you're excited about for 2026.
Well, I would say the tip I would leave for if you are just, somebody who's tuned in that's just, from a regular sort of patient or you're curious about it and you're not a healthcare professional. But if you are a healthcare provider, whatever you are, it's, you approach, it's okay to have a healthy level of skepticism. But I could tell you that was me. There's a thing that we say within this community, which is just try it. Just go ahead and try it. You have nothing to lose. It can't harm you. Give it a try. Give it an honest try. Apply it routinely and experience the results for yourself. And you can't do that if you're not going to dedicate, you have to be using this consistently for a period of time to truly see a result. If we're on a journey and we're going to start eating better, if we move to an anti-inflammatory whole food nutrition for 3 weeks and we see these awesome results, Jess, what happens when we stop?
You want to get right back on the wagon, right?
Right. Okay. So what happens if you want to get in shape and you start exercising and in 3-4 weeks, you're happy, you're starting to see these results, and then you stop and you just go back to not exercising again. What happens to your body?
It is not going to feel great.
Right. So things go backwards, right? Mm-hmm. So with carnosine, as we do this, it is a wellness supporting type of thing. So regardless of when you go through and you're trying to address a specific condition, give that a certain period of time, but then move into the wellness phase. And it's certainly something that is a hot, and this will be around for a while. This will be a hot product for a long time, and something to help support wellness for a long time.
I love that you hit on that. And you guys, like Dr. Kevin Key said, just try it. But this hasn't just come out, right? This has been a hot product, but it was only a secret for athletes. Ooh. Now we are getting our hands on it. So super, super exciting. And we are listening to you. Those of you who are typing questions in the chats or comments, we're listening to you, and we are going to address them each and every week on the Carnosine Conversation. So do not miss the next Carnosine Lab, because you guys, this conversation is just getting started. There are some more things coming out as our knowledge and the technology is expanding. You're not going to want to miss some of these updates. So next week, we have an incredible physician on. The following week, we have an amazing update, an exciting update that is expanding this into the world of animals. So this conversation is just getting started. Dr. Kevin Keys, it has been such an honor, a privilege, and a blessing to have you on with us tonight. Thank you for taking time out of your busy practice, your life, your family, your schedule to be with us, to educate us, and to share with the viewers your clinical expertise over there in Texas. Again, those of you tuning in, like us on Facebook and YouTube, subscribe on YouTube, Instagram, and Facebook, and we look forward to seeing you guys each and every Tuesday night, 7 p.m. Mountain Time, all across the world. Thanks again for having us, and we'll see you all next week. Bye for now.
Bye.